Choosing a rhinoplasty surgeon is a lot like choosing a spouse. Ideally, you don't have to choose a second one. So let's consider this premarital counseling before you make your decision on who to use for your rhinoplasty surgery. Because with rhinoplasty, the best way to avoid a revision is to make the best choice up front. Choosing a rhinoplasty surgeon is unique, given the need for form and function, as well as the location. It's a very prominent and visible area of the face. Rhinoplasty is both cosmetic and functional. A beautiful nose that doesn't breathe well is a failed result. A quote-unquote improved result that doesn't fit the patient's face, ethnicity, etc. is not a good result. The goal is not to find a surgeon that just presents well online. You want to find the surgeon that's best for your anatomy, your goals, and your expectations. Patients should be careful about choosing a surgeon based on social media, based on price, based on a few dramatic before and afters. Rhinoplasty is a procedure where millimeters matter, not just cosmetically, but functionally. My name's Dr. Colin Pero. I'm a facial plastic surgeon in Dallas, Texas. I specialize in complicated nasal surgery, primarily rhinoplasty, revision rhinoplasty, and facial plastic surgery. I was fortunate enough to train with Dr. Dean Toriumi, in my mind, the best nasal surgeon ever to have lived. And as such, my career since I've been out over 15 years ago now has been focused on complicated and revision nasal surgery. In this video, I'm going to help you to choose the right rhinoplasty surgeon. What credentials matter, what questions to ask, how to analyze before and after photographs, and what red flags you should be looking at. Why is choosing a rhinoplasty surgeon different than choosing a surgeon for other procedures? Well, for starters, the nose has a central location on your face, so it's very visible. It is involved in both form and function, so you need to be able to breathe well as have it look nice. It's a surgery of subtlety. Millimeters really matter as far as the shape as well as the function of the nose. The nose is unique anatomically. You've got bones, cartilage, fibrous tissue, skin on the outside, mucous membrane on the inside. It's really a unique structure that's unlike any other surgical site. Revision rhinoplasty is usually more complicated than the first surgery and it requires a set of specific skills that's different than primary surgery. That being said, choosing the right surgeon for your primary surgery is the best way to avoid a revision surgery. In rhinoplasty, you're not just trying to make a nose, for example, that's straighter or smaller. You're trying to make one that fits with the rest of the face and it's in harmony and not a distraction compared to the rest of the facial features. What kind of experience should patients look for in a rhinoplasty surgeon? Ideally, you want to have a surgeon that's at least 5 years into their practice, so they've learned some things and been able to make some mistakes and figured out how to make some corrections. Board certification matters, but only to a point. Board certification means that there's an independent body that states that your surgeon is competent to perform the surgery in one particular field. So not all board certifications are the same. Specifically, board certification in plastic surgery or facial plastic surgery is unique because it does test the ability of that surgeon for knowledge as well as experience on surgeries, including the nose. Probably the most important thing is how often does your surgeon perform rhinoplasty? If this is an occasional procedure for them, this is probably not your best choice for surgery. Ask questions specific to your nose. If you have thicker skin, if you have had trauma before, you've had previous surgery, if you are of a specific ethnic group and you want to know if your surgeon has operated on any or all of those fields, ask the questions. If they haven't, then it should be a red flag that maybe this might not be the surgeon for you. If you are starting out with breathing problems in your nose, be very comfortable that your surgeon understands those problems from a functional standpoint and how to address that at the same time. Sometimes patients with only cosmetic concerns end up with functional problems after surgery. So I would ask your surgeon if they perform nasal surgery for breathing purposes as well to make sure that A, it's either corrected at the time of surgery or B, avoided after the surgery. Questions that you should ask. How often do you perform rhinoplasty? Do you treat both cosmetic and breathing problems with the nose? Do you perform revision rhinoplasty? Do you commonly work with noses similar to mine? What makes my case straightforward? What makes it complex? A good rhinoplasty consultation should involve both how the nose looks as well as how it functions. Why does breathing matter if someone only wants a cosmetic rhinoplasty? Often during rhinoplasty, we're narrowing structures of the nose for a more appealing cosmetic appearance, right? So what happens when you narrow airflow in anything, a pipe or a nose? It can restrict the airflow to some degree. Narrowing the nose without providing sufficient support can cause long-term breathing problems, leading to revision surgery for functional reasons. A good rhinoplasty surgeon should inspect not only the outside of the nose, but the inside of the nose as well. The plan should always be to preserve or improve function as much as possible. Many patients undergoing rhinoplasty already have a deviated septum, whether they know it or not. They may have nasal valve collapse, where the outside parts of the nose collapse inward. It's common for patients to have had previous trauma to the nose and have asymmetries in the nasal bones or the cartilages, which could complicate the breathing problems after surgery. The outside of the nose and the inside of the nose are connected. It's literally a few millimeters in thickness. So you can't separate cosmesis with how it looks on the outside without thinking about the function of what's going on the inside. The goal is not just a nose that photographs well. It should also function well. What should patients look for in before and after photos? I think the first thing is looking at the number of results. Just a few photographs on a website is concerning. You want to see that they've been able to establish consistent results with variable anatomy in different patients. Try to identify patients with similar anatomy to your own, whether that be the pre-existing appearance of the nose or of other facial features, to make sure that they were able to establish harmony. At a minimum, look at the front view. Look at the oblique view from one angle, look from the side, look from the base. If they have the views from above, that can be helpful as well. Ideally, the nose should flow well from one part of the nose to another, from the bridge or the dorsum to the tip to the side walls that we call the ala. There shouldn't be sharp shadows separating those. They should all flow well together and look natural. When the nose is pinched, you end up with shadows along the tip of the nose that can be, number one, not very pleasing cosmetically, but also the sign of progressive pinching and collapse that can lead to functional problems. Obviously, asymmetries, scarring are things that are best avoided. So while it's impossible to get the nose completely straight in some patients, it should be so minimally noticeable that only close inspection reveals that. Try to avoid results that look consistently the same. The same nose on everybody is not going to fit every face. There's unique anatomy to the rest of the face, and the nose should match that accordingly. Ask about how far the results are. A 1 month result looks very different at 1 year. Ideally, you want to see photographs that are at well past 6 months, ideally 12 months or beyond, to show long-term results. So questions to ask when reviewing the before and afters are, do you have any patients with anatomy similar to mine? Are these results early or long-term? What changes were realistic for this patient? What would be different in my case? Rhinoplasty involves judgment. And so the long-term results in the before and after photographs should demonstrate to you what your surgeon's aesthetic is, what they think looks good. And so you may have a different opinion. And if you don't see that aesthetic on the before and after results, then you need to ask to see results that are more similar to what you're looking for. A lot of this is just opinion. What I think looks good is not necessarily a good result if you don't think it looks good. So before and after should show judgment and aesthetic opinion, basically, not just the technical ability. What should happen during a good rhinoplasty consultation? The surgeon should ask not only what bothers the patient, but it should also educate about what is realistically possible. The examination should include both inspection, looking at the nose, palpation, feeling the nose, as well as the inside of the nose, both inspection with a speculum to look inside the nose and possibly with a nasal endoscope to further evaluate for any functional problems. The surgeon should be able to talk about things like cartilage consistency, skin thickness, facial balance, symmetries, asymmetries, including asymmetries of your face that the nose needs to take into consideration when taking its final shape to make sure there's harmony. The patient should feel like they're being educated, not rushed, and it should be an individualized plan unique to every patient. Imaging of clinical photographs is very helpful to demonstrate potential outcomes, but they're not a guarantee of outcome. So that has to be taken into consideration. I mean, think of the consultation as a first date. This is the beginning of a relationship. All of my rhinoplasty patients come back and see me for a year. And so not only are you listening to what I have to say to make it sound like something that is reasonable, but I'm also interviewing you to some degree because we're going to be getting into this together for a year. So you have to have a good understanding of what is realistic and what your expectations should be before going into this. I think you should feel similarly with your rhinoplasty surgeon, that you feel comfortable having a longer term relationship with this person because they really are listening to what you want and are going to listen to your needs and concerns before surgery as well as after. A good consultation should explain what's possible, what's not possible, and what trade-offs may exist. If a consultation feels more like a sales pitch than a medical evaluation, it should give you some pause. What should patients understand about revision surgery and long-term follow-up? Dr. Toriumi during my training would often say that he's never done a perfect nose, and that's the man that I think is probably the best rhinoplasty surgeon ever to have lived. So to think that I'm going to promise you perfection is completely unrealistic. No surgeon can promise you perfection. Rhinoplasty has a prolonged healing process. You may think it looks pretty good at a month, but it's going to be a lot better at 3 months. And you're going to think at a year that you were done at 3 months, but you weren't even close in retrospect. There's variability in healing. Swelling, skin thickness, scar tissue from previous surgery, all of those can affect the result as well as the healing time in the process. Minor imperfections may require in-office, small procedures, touch-ups, etc. But even in the best hands, there are occasional needs for revision. So follow-up in our office is done 6 days after surgery for cast, suture, and splint removal, typically a month after that, typically 6 to 8 weeks after that, and then every 3 months until we get to the 1 year post-op mark. At that point, it's individualized with most patients not needing any further follow-up, but if they are thicker skinned, multiple revision patients, sometimes we'll see them for years to come as there are subtle changes continuing to occur. For our out-of-town patients, initially we can sometimes see them as a virtual consultation. We obviously need to see them in person prior to surgery, but that could even be the day before if necessary. They are in town for a week. We see them back typically at that 6-day mark where we get the cast, the sutures, and the splints out. They're then able to fly home. We'll usually do a 1-month telemedicine visit, follow-up thereafter. And then their next visit, which is typically 6 to 8 weeks after that one, we'd like to see them in person. And then we play it by ear somewhat. Typically, we'll see those patients every 3 months until we get to the 1 year mark. Depending on how they're progressing, sometimes we can alternate virtual visits with in-person visits. You should feel comfortable understanding the follow-up schedule and what that is going to entail, both from the nurses that are going to contact you potentially right after surgery, to the pre-op visits, to the need for in-person visits and what frequency thereafter. Your relationship with your rhinoplasty surgeon does not end when your cast comes off. So how do patients know if their expectations are realistic? A good rhinoplasty surgeon should listen, but also be willing to say no. While I love looking at inspo photos, it's not always realistic to think that that's a reasonable result for your face or your anatomy. The best rhinoplasty results are the ones that fit the patient's anatomy, fit their ethnicity, function well with good breathing, and result in happy patients. If a surgeon promises you that your nose can look like a celebrity's, or they promise perfection, that's time to leave their office. Rhinoplasty is about refinement. It's about improvement. It's not about perfection. It's about balance and function. So the happiest rhinoplasty patients are not the ones that are trying to chase after somebody else's nose. It's the ones that are trying to just achieve improvement in their own nose and achieve better harmony and balance with the rest of their facial form and achieve better function as well. What are some warning signs that patients should watch out for? Surgeon minimizes any concerns about your breathing. Surgeon promises perfection. The plan or the result sounds or looks the same for every patient. The consultation feels rushed. They have very few rhinoplasty before and after examples. The surgeon avoids or declines to discuss risks or limitations. The price seems unusually low given the complexity of the procedure. The patient feels pressure to book quickly, or the surgeon dismisses the patient's concerns instead of explaining. Confidence is good. Overpromising is concerning. If someone is comparing surgeons, what checklist should they use? Does this patient have experience specific to rhinoplasty? Do they understand the balance between appearance and breathing well? Do the before and after photographs show consistent, natural appearing results? Did the consultation feel detailed and honest? Did they explain risks, limitations, and recovery clearly? Do they offer appropriate follow-up and long-term support? And did I feel comfortable asking questions? The right surgeon should make you feel informed, not pressured. If you're considering rhinoplasty, choosing the right surgeon is the most important decision you're going to make. You should look for somebody who understands the cosmetic and the functional aspects of rhinoplasty. You should look for somebody who understands your particular anatomy and how they're going to make changes in your particular nose. And you should just feel like that person is being honest and trustworthy with you. If you'd like to learn more about your options, you can visit drpero.com to schedule a consultation, including virtual consultations for our patients outside the Dallas-Fort Worth area. If you found this video helpful, make sure to like this video and subscribe to my channel. We'll continue making educational videos about rhinoplasty, facial plastic surgery, recovery, and what patients can realistically expect. We'll see you on the next one.